Into what some people in psychology consider the nitty-gritty of psychology. We're going to talk about psychopathology. And actually, the last three chapters deal with psychopathology. So here we go. Maybe. There we go. According to the study of National Institutes of Mental Health in 2005, 32.2% of the population in the United States will have a psychiatric disorder sometime in their lives. That's one out of every three. So if you have six people in your family, two of you will have, well, that's statistically, of course, two of you will have a problem. With any given 6-month period, 19.1% of the population suffers from a psychiatric problem. The NIH study in 2005, 16.4% of the U.S. population will suffer from some form of substance abuse in their lives. 6% have suffered some form of substance abuse within any 6-month period. 13.3%. What did I see today? Oh, Matthew Perry was on. Matthew Perry used to be when he was on Friends, and evidently he had an addiction problem throughout his entire time when he was on Friends. 13.3% of the population will suffer alcohol abuse or dependence in their lives, and he was using alcohol. He was also on painkillers. 4.7% have suffered alcohol abuse or dependence within 6 months. 5.9% of the United States population will suffer from drug abuse or dependence in their lives. 2% have suffered some form of drug abuse or dependence within any 6-month period. 1.5% of the U.S. population will suffer from schizophrenia in their lives. 0.9% have suffered some form of schizophrenia within the last 6 months, within any 6-month period. 8.3% of the U.S. population will suffer from an affective disorder, manic or depressive episodes, sometime in their lives. 5.8% have suffered some form of affective disorder within any 6-month period. 0.8% of the United States population will suffer from a manic episode in their lives. 0.5% have suffered some form of manic episode within any 6-month period. 5.8% of the U.S. population will suffer from a major depressive episode in their lives. 3.3% have suffered some form of major depressive episode within any 6-month period. 33% of the U.S. population will suffer from minor depression in their lives. An undisclosed number will suffer some form of minor depression within any 6-month period. 14.6% of the U.S. population will suffer from an anxiety disorder in their lives. 8.9% have suffered some form of anxiety disorder within any 6-month period. 12.5% of the U.S. population will suffer from a phobia in their lives. Her phobia is bugs. You can see the butterfly on her hair, on her head. 7.7% have suffered some form of phobia within any 6-month period. 1.6% of the U.S. population will suffer from a panic disorder in their lives. 0.8% have suffered some form of panic disorder within any 6-month period. 2.5% of the U.S. population will suffer from an obsessive-compulsive disorder in their lives. 1.5% have suffered some form of obsessive-compulsive disorder within any 6-month period. Obsessive-compulsive disorder. Seems like there's a lot of these guys teaching college classes. Not me. I'm not obsessive-compulsive, but I've been around awful lot of college professors that are just a bit wound a little bit too tight. A study by Kessler and his colleagues in 1994 disclosed that almost half the population would suffer from a psychiatric disorder in their lifetime. 30% of his respondents reported a psychiatric disorder within the previous 12 months of the survey. At the turn of the 20th century, 20 to 25% of all inhabitants of mental hospitals around the world suffered from delusions, grandiosity, and euphoria, poor judgment, impulsive and capricious behavior, and profound changes in thought structure. In 1911, this problem was identified as syphilis. Since the development of antibiotics, the number of people suffering from paresis, which is what all those symptoms entail, has been reduced to zero because we treat syphilis with penicillin. This is a spirochete, palladium. What is it? Yersinia palladium? No, it's not it. Gee, I can't think of it. This is what it looks like under the microscope. As you can see, these are bacteria. Each one of the, these corkscrew-shaped bacteria, they're known as spirochetes, and that's Treponema pallidum. That's what it is. Treponema pallidum is the bacteria that causes syphilis. Why do I know that? Because I was a laboratory technician when I was in the military, and one of the things that we did was look for syphilis. We looked for gonorrhea a lot too, because soldiers tend to have sex with people that they potentially should have had sex with. Anyway, that's a spirochete. This is a cocci, and that's a rod. And these are spirochetes, and that's what a spirochete looks like under an electron microscope, as cute as that is. Most psychologists consider schizophrenia the most serious of the mental disorders. Schizophrenia is known in every culture around the world. 1 to 2% of any population will suffer from symptoms of schizophrenia. It doesn't really matter where it is, whether it's Germany or China, Japan, Russia, Israel, Ghana, Colombia in South America. It really doesn't matter. Canada, the United States, 1 to 2% of your population will have symptoms of schizophrenia. While the description of the symptoms of schizophrenia has changed over the years, the symptoms themselves have remained basically the same. There are positive symptoms and there are negative symptoms. The positive symptoms are things that are added to you. Hallucinations. Normally you don't have hallucinations. Delusions, excited motor behavior. Those are the things that are added to you. Negative symptoms are things that are taken away from you. Slow and impoverished thought and speech. Emotional and social withdrawal. Blunted facial expressions. So we have positive and negative symptoms. Once you lose it, it's gone. That's the way it works with the negative symptoms. Family studies of schizophrenia is genetic, then relatives of schizophrenic should have a higher incidence of schizophrenia than the public at large. While the general population has 1 to 2% incidence rate, parents have an incidence rate of 6%, siblings 9%, and half-siblings 6%. The closer the relation, the greater the risk. And this is what a patient with schizophrenia looks like. Maybe. Oh, this video is unavailable. I'm sorry. I apologize. I'll have to take that off. Family studies comparing monozygotic and dizygotic twins. Monozygotic twins have an amazing 48% incidence rate, while dizygotic twins, monozygotic twins are identical twins, of course, and dizygotic twins are fraternal twins. They have a 17% incidence rate of schizophrenia. Children of schizophrenics have a 13% incidence rate. So if you have a parent who is suffering from schizophrenia, you have a 1 in 8 chance of being schizophrenic as well. Work by E. Fuller Torrey has shown that when one twin is different, it is observable early in life. Research by Torrey looking at discordant monozygotic twins shows that the twin that develops a schizophrenia is the lowest birth weight and the one who is most abnormal throughout their lives. Elaine Walker looked at monozygotic twins in a similar manner. Walker proved that even the least indoctrinated layperson could pick out the future schizophrenic twin from home movies. This they were able to do with uncanny accuracy. You didn't need to be a psychologist. You didn't need to study psychology. If you looked at these two people, you could tell which one it was. It's the one that doesn't smile. That's a smile, actually, and so is that. It's the one that doesn't smile. It's the one that it's difficult to get them to smile. They also like to duck out of pictures. They turn away from the camera. It's fairly obvious which one was having problems. I do have a niece who has schizophrenia. who has been diagnosed with schizophrenia, and I don't have a picture of her ever smiling. I don't. It's really, and she was my son's best buddy when my son went back to Indiana. We were military, of course, so they only got to go to Indiana usually in the summertime, but sometimes uh, at other times. But whenever he was home, that he got to be her playmate. Lucky him. Work by Levy et al. In 1993 and Stuve et al. In 1997 demonstrated that individuals suffering from schizophrenia are unable to follow a slow to and fro movement, such as the pendulum of a clock. Schizophrenics tend to have their eye movements interrupted with jerky eye movements called saccades. And this is what, if you were following a clock, oops, I'm sorry, wait a second. Okay. If you were following a clock, this is what it would look like. If a schizophrenic tries to follow somebody suffering from schizophrenia tries to follow the pendulum of a clock, this is the way it would look. They couldn't follow it. Work by Ketty and her colleagues in 1975 and again in 1994 looked at the psychiatric histories of adoptees and their biological and adoptive parents. Ketty et al. Discovered that of the adoptees who suffered from schizophrenia, the biological parents were far more likely to suffer from schizophrenia than the adoptive parents. So you're not trained to be schizophrenic, it's there. Combining the twin families and adoptee studies, many researchers have concluded that there is a genetic factor in schizophrenia that is inheritable. What structure is being inherited? What structures are involved? Which genes are being inherited? And what processes do they control? While autopsies often found enlarged ventricles on people suffering from schizophrenia, it wasn't until the brain imaging techniques, CAT scans, and MRIs that this was confirmed in living patients at all stages of the disease. There's always a question of an effect, if an effect is caused by the disease or the effects of the disease. Schizophrenics are known to have dietary limitations. They won't eat. Prolonged stress, of course, might cause this problem. The toxic effects of antipsychotic drugs might be causing the brain to hollow out, as it were, the ventricles enlarging. The more advanced the case, the greater the enlargement of the ventricles. The larger the ventricles, the poorer the response to antipsychotic drugs. Research has also shown that the lateral ventricles tend to be the most likely to be affected. And this is what we're talking about, the ventricles. This is what a normal brain looks like. And this is what a individual with schizophrenia. Now, if you look at the whole brain and the structures in the brain, the sulci and the gyri and the sulci, you can see that there is much more. This brain is taking up much more of the skull than this one is. You can see how big these gaps are. Discordant twin studies where one twin was has schizophrenia and the other doesn't, showed that in 75% of the cases, the hippocampus and the amygdala were smaller in the schizophrenic twin. Researchers speculate that the enlarged ventricles and smaller brain structures denotes atrophy of neural tissue. Looking deeper into the hippocampus, researchers have discovered that the pyramidal cells of people suffering from schizophrenia are disorganized in the sufferer as compared to a normal individual. The degree of disorganization relates directly to the severity of the disorder. And this is what it's supposed to look like, the hippocampus. This is an organized pyramidal cells. This is what it looks like in somebody suffering from schizophrenia. So you can imagine why all these connections that are supposed to have taken place and giving you a organized way of thinking, organized way of speaking, that just isn't going to happen here. Machon and her colleagues speculate that this derangement in the hippocampal pyramidal cells occurs due to maternal exposure to the influenza virus during the second trimester of pregnancy. So what would that be? When does flu usually hit? Flu usually hits in the fall. So somebody suffering, if she had the flu during the second trimester, that means that she would deliver sometime in the early next year. Is that right? Yeah, she'd deliver within 3 months of having the flu. Now, the flu usually starts, uh, this year it started early, but normally it starts in November and December and January are the worst months. So somebody born in the spring would uh, more likely have this problem. Not somebody born in the fall, not somebody born in the summer, but somebody born in the spring. Now, my niece who has schizophrenia was born in December. But there were other complications. Her mother had high blood pressure through most of her pregnancy, and she suffered from preeclampsia before the baby was born. So that may have caused other problems. Looking at blood flow in the brain during the resting state, researchers have discovered that in the brain of a schizophrenia sufferer, the left hemisphere is more active than the right hemisphere in the frontal lobe. PET scans indicate that people suffering from schizophrenia have less metabolic activity in the frontal lobe. This is a normal control, and this is somebody suffering from schizophrenia. This is the front of the brain. This is the frontal lobe right there. Much of the proof that dopamine is a neurotransmitter that is the cause of the symptoms of schizophrenia comes from pharmacological studies. Tens of thousands of schizophrenia sufferers were able to leave psychiatric hospitals when chlorpromazine was discovered. Chlorpromazine and the phenothiazines block D2 type receptor sites. Due to the pharmacological evidence, it seems that the effectiveness of the antipsychotic agents is directly related to the magnitude of postsynaptic receptor blockade of dopamine sites. Parkinson's disease is caused by the degeneration of the nerve cells in the substantia nigra, which contain dopamine. When a patient is given too much L-DOPA to compensate for the lost dopamine, they develop schizophrenic type symptoms. Some schizophrenic patients will develop Parkinsonian type symptoms if over-medicated with phenothiazines. However, some schizophrenia sufferers treated with dopamine inhibitors do not respond. Recently, a new generation of antipsychotics have been developed that do not affect just dopamine levels, and they work. These new drugs are referred to as atypical antipsychotics. And there you go. And this is, you see advertisements for these medications on television, especially Abilify. Seroquel, Zyprexa too, risperidol. Clozapine is an atypical antipsychotic drug that not only blocks dopamine receptors, but serotonin receptors as well. Clozapine actually seems to increase dopamine reception in the frontal cortex. One theory about the development of schizophrenia is that select chemicals build up or are created in the brain that cause the psychosis. These substances are referred to as psychotogens, literally brain monsters. One theory is that an addition of a methyl group to the brain chemistry can cause the conversion of normal compounds known as hallucinogenic agents. This is known as the transmethylation hypothesis, the methyl crossing process. That's what transmethylation process means, methyl crossing process. The psychobiological model of schizophrenia emphasizes that there may be several factors interacting that cause schizophrenia. Each life phase of brain development provides uh, potential triggers to the development of schizophrenia. People genetically predisposed with brain abnormalities may or may not experience the proper triggers in the correct sequence to create the conditions for schizophrenia. Viral illnesses such as influenza and inoculations may be part of the trigger. The stress of urban life as compared to rural life shows that more people per capita have schizophrenia in urban settings compared to rural settings. Thus, schizophrenia may emerge from when the combination of stressors are added to the neurobiologic triggers and the genetic brain abnormalities. Autism is a lifelong developmental disorder characterized by impaired social interaction, impaired language, a narrow range of interests and activities. They may perseverate from persevere, head nodding, ritualized finger movements. They have difficulty judging other people's thoughts and feelings. Autism seems to have a strong heritability. It occurs in 1 to 2 children per 1,000. It is far more common in males than in females. A study by Rodier in 2000 demonstrated a common abnormal allele on the Hox gene of the 7th chromosome. They also have a reduced size of the corpus callosum and a reduced size in select cerebellar regions. And this is an example of the reduced size of the corpus callosum, normal corpus callosum, and this is one of someone with autism spectrum disorder. While periods of unhappiness affect everyone from time to time, prolonged chronic depression occurs most often in people over 40 and women 2 to 3 times more frequently than men. Depression is not sadness, but is characterized by unhappy moods, loss of interests, energy and appetite, difficulty in concentration, restless agitation. Depression may not be triggered by any apparent stress. Without treatment, it may last for months. Depression may afflict 13 to 20% of the population at any one time. Bipolar disorder is diagnosed when someone who suffers from depression also displays episodes of excessively expansive moods, which include sustained overactivity, talkativeness, increased energy, strange grandiosity. Now let me try another one. Let me see if this one works. Uh-oh.
Call now to learn about Medicare Advantage plans from Wellmark Advantage Health Plan. Blue is how you get a...
Bipolar disorder seems to get a bad rep, but a lot of people in the public eye have come forward and bravely discussed their struggles with the condition. So what exactly is bipolar disorder? Hey guys, Julia here for D News. If you're as big of a fan of Demi Lovato as I am, you know the confident singer is an outspoken activist for mental health issues. Several years ago, she came forward and admitted to her own struggles with bipolar disorder, formerly known as manic depression. Even as the disorder becomes more of a focus in the public eye, a lot is still misunderstood. Bipolar disorder is most known for the way it affects people's moods. It often creates an uncontrollable change in moods that can impact daily life for the 3% of Americans with the condition. While researchers aren't sure what causes it, the risk factors for bipolar include genetics and environment, things like stress, substance abuse, and even lack of sleep. But really, it can affect anybody. What a lot of people don't understand is that bipolar is more than just a single diagnosis. There are different categories, almost a scale of bipolar disorder. The symptoms vary from person to person. Some people's manic episodes leave them feeling exuberant and energetic. They feel really creative, like their brain is working faster than usual. This is usually less severe than mania and is classified as hypomania. In others, mania can make them go without sleep for 3 days or gamble away all their savings. There's type 1, which is what most people think of when they think of the disorder. Its symptoms include extreme manic episodes in which someone acts more erratic than usual. They have grandiose ideas, an exaggerated sense of importance and skills, higher sex drive, and higher impulsivity. While the highs are really high, the lows are just as extreme. People with type 1 have periods of extreme depression too. Bipolar 2 is similar to type 1, but low moods tend to dominate with less frequent episodes of less extreme hypomania. Rapid cycling, just like it sounds, is when someone goes through 4 or more periods of manic or depressive episodes in a 12-month period. Yet another type of bipolar disorder is cyclothymic, which has several less extreme manic episodes and less extreme depression. But no matter what type, bipolar disorder is mostly characterized by the swinging of moods from low to high. Sometimes these moods can last for weeks or months, other times they're as short as days. And to some, you would think the high episodes sound great. Who wouldn't want to feel important, smart, and driven with a flight of ideas? It's these kind of moments that make creative people with the disorder so productive. Many creative types, painters, writers, even actors have been diagnosed with some type of bipolar disorder. I've talked about this link before in another episode, but like I said, there's a downside too. Sometimes those grand ideas include delusions, like taking over the government or winning the jackpot at poker. Both the highs and lows can be very disruptive to someone's life. One study published in the journal Nature found that some people with bipolar disorder are more sensitive. Essentially, their brains are literally more sensitive to stimuli than others. In the study, researchers took skin cells from participants, turned them into stem cells, then coaxed them into becoming neurons. They found that some people's neurons are physically more sensitive when stimulated than others. Other imaging studies found differences in the brains of those with bipolar disorder. One study published in the journal Molecular Psychiatry found differences in white matter and in the cerebellum. The researchers used an MRI technique that searches for signatures of certain byproducts of cell metabolism. This technique found higher readings of white matter in the cerebellum in those with bipolar disorder than those without the condition. The research also found that there were no differences in the cerebellum in those participants with bipolar who were taking a common form of treatment for the condition called lithium. Lithium is just one of several effective treatment options, like other mood stabilizers, including valproate. According to a review published in the journal Current Opinion in Psychiatry, even some anti-seizure medications have been shown to be effective in treating the condition. Beyond medication, different types of therapy help, like cognitive behavior therapy, which helps patients build a toolkit of sorts for dealing with dysfunctions in thought patterns and information processing, or interpersonal and social rhythm therapy, which helps patients figure out how their routine and social situations affect their moods. Many people with bipolar disorder go on to live wonderful, healthy lives, but it starts with getting help. Check out resources like the Depression and Bipolar Support Alliance at dbsalliance.org. Art and creative outlets also help many people with psychological conditions heal. But what is the link between creativity and mental illness? Find out more in this episode right here. Some studies find a higher incidence of mental disorders in those who...
That's enough. Let's just go. There we go. Okay, so bipolar disorder. Depression may lead to suicide. Estimates are that 80% of the people who commit suicide are profoundly depressed. While suicide rates overall are decreasing in the Western Hemisphere, disturbing indications are that suicide in the younger population is increasing. Increased use of drugs among youth may be causing suicides. Looking at the concordance studies, the incidence of depression is much higher among dizygotic as monozygotic twins. Concordant studies of monozygotic twins raised apart shows equally similar results. These studies point to a strong heritability of depression. And I have the Olsen twins here, mainly because it says stressed, depressed, but well dressed. That's not why I put that there. I put that there because they're monozygotic twins. Depression is common in select medical conditions, especially those that involve the endocrine system and brain disorders. Cushing syndrome is caused by lesions on the pituitary gland that cause an excess amount of ACTH and hence cortisol. The first symptom is depression, followed by obesity, unusual growth and distribution of body hair. Parkinson's disease. 50% of the people who suffer from Parkinson's disease suffer from depression that can be attributed to no other symptom. This may be due to lowered levels of serotonin from loss of neurons in the dorsal raphe nucleus, where large amounts of serotonin are stored. And there is where the dorsal, I don't have an arrow. Respirine, a drug that increases monoamine oxidase and thus depletes serotonin and norepinephrine, causes profound depression. Some researchers have looked at these effects and point to increases in monoamine oxidase as the cause of depression. Electroconvulsive therapy also reduces depression by reducing biogenic amines, which, of course, then form monoamine oxidase, monoamine, And if you reduce the biogenic amines, you don't have as much monoamine oxidase. All around the world, more women than men suffer from depression at a rate of about 2 to 1. Several interesting studies show that rates may actually be closer to the same for men and women. The study of depression rates among the Amish shows men and women with similar rates. What is the intervening variable? Amish men do not drink alcohol. Men are more likely to self-medicate with alcohol than women are. Sleep studies of depressed patients show that people suffering from depression spend much more time in stages 1 and 2 and much less time in the more restful stages of 3 and 4. This means that depressed people jump into REM episodes much earlier than people with normal sleep patterns. REM sleep seems to be more intense for the depressed. Studies show that the shorter the time that it takes to go into REM, the more severe the depression. One of the effects of the antidepressant monoamine oxidase inhibitors is the fact that it reduces REM sleep. Research by Ontiveros and his colleagues found that 40% of the people they tested had abnormalities in their temporal lobe. We're talking about panic attacks. Even in a resting state, these individuals have increased activity in the hippocampal area, an area known to induce fear when stimulated. The most common treatment of anxiety is the pharmaceutical benzodiazepines, such as diazepam. Diazepam is another name for Valium. Benzodiazepine works because it changes the permeability of neural membranes to chloride ions, especially those that react to GABA. The influx of chloride ions inhibits the firing of the neuron. Studies of individuals suffering from PTSD have shown that, on the average, their right hippocampi are 8% smaller than people without PTSD. High levels of circulating glucocorticoids from the chronic and intense stress of the PTSD may have caused the cell loss in the hippocampus. Research looking at OCD has found that sufferers have increased metabolic activity in the caudate nucleus, the left orbital gyrus, the left anterior cingulate cortex, and bilateral orbital frontal cortex. Increased serotonin levels decrease OCD symptoms, especially the tricyclic clomipramine. Tourette's syndrome is a tic disorder. These individuals seem to be unable to stop themselves from motor tics, vocal tics, compulsive actions. The average age of onset is 6 to 7. These children may also have problems with ADHD and OCD. There's a single gene that may cause the problem. Concordance rates of monozygotic twins is 53 to 77%. Indications are that dopamine receptors D2 are more sensitive in these individuals, causing involuntary movements. Mad cow's disease is caused by bovine. Wait a minute. Well, I don't have. Wait a minute. Okay. No, I need my arrow. Let's see if this works. And it doesn't. Okay, anyway. Mad cow's disease is caused by bovine spongiform encephalopathy. It's caused by what is known as a prion. A prion is a mutated protein, and when a prion is close to a protein molecule, what it will do is that it will convert that protein molecule to a prion. So it contaminates it, and it takes away its properties as a protein. Now, everything in your body is made up of protein. All your cells in your body are made up of proteins. So what happens in the brain, if this gets into your brain, is that it causes holes like Swiss cheese. And that the reason is because those prions are right next to those proteins. The proteins become prions, and now all of a sudden you have an open area where there was a protein before. Now it's a prion. This is what a protein molecule looks like. This is what a prion molecule looks like. And this is what happens to your brain. Now, this has happened before. What is it? Jacob's, right? Oh, jeez. I should have looked this up before the lecture. Anyway, this has happened in humans. So if mad cow's disease, of course, this is what happens to a cow, gets into your central nervous system, then they can't stand up because their spinal column isn't working. Their brain, of course, looks like this instead of this. But if we eat this substance, if we eat the meat from this cow, especially the part that's contaminated, we will get mad cow's disease. And this is what happens to a human brain when it is infected by Jacob's Creutzfeldt disease. That's what it's called. It's not really mad cow. But we have seen this before. The headhunters in New Guinea, they would eat the brains of their the people that they conquered, and if Jacob's Creutzfeldt was in that population, it would of course contaminate the headhunters, the cannibals that ate the brains. Anyway, that's mad cow disease. That's why we are so afraid of it. And that is the end of your lecture, or it would be. There we go. Okay, so I'll see you guys next time.